Hi, my name's Dr. Adam Fox and I'm a consultant paediatric allergist at St Thomas's Hospital. I'm going to talk about the possibility that some children with milk and egg allergy may be able to eat milk and egg in the baked form. What we're talking about here are children who have immediate type IgE-mediated allergies. When they eat milk or egg in the plain form, they get very quick onset of symptoms such as itchiness and swelling and hives, and if they're very unlucky, those reactions can be quite severe. It became apparent a few years ago that many children with these allergies seem to be absolutely fine when they have milk or egg when it's in the baked form. And a number of research studies have meant that we now understand this a lot better. For both milk and egg, around 75% of children who suffer with the allergy have a type of allergy where the part of the milk or egg that they're allergic to changes shape when it's been extensively heated and baked so that the immune system doesn't recognize it anymore. As a result, when these children eat egg or milk when it's baked, so for example in cakes or biscuits or muffins or waffles, they don't react. As a result, this means that many of the children who suffer from milk and egg allergy can introduce these foods into their diet. Not only will it mean that they can have a much broader range of foods, and of course they're commonly foods which children enjoy, but interestingly it also turns out that the more regularly that they eat the baked milk or baked egg, the quicker they outgrow their allergy to the plain egg or plain milk. As a result, we now encourage children where it's possible to do this. We now have a better understanding of these two different types of milk and egg allergy, and we can divide children who have these allergies into two basic groups. On the one hand, we have children who have the milder forms of milk and egg allergy. These children can eat egg or milk when it's in the baked form. They tend to outgrow their milk or egg allergy earlier, often around 2 to 4 years of age. They rarely have severe reactions to milk or egg, and when you do allergy tests, they tend to have smaller positive tests. This is in contrast to the children who have the more severe form of milk or egg allergy, about 20% of kids who have the allergies. These children have to avoid milk or egg in all forms because even when they have it baked, they still have a reaction. They tend to outgrow their milk allergy and egg allergy when they're older, although they do still generally outgrow it. But they do have more of a risk of having severe reactions. They tend also to have larger allergy tests when you test them. However, these differences between the size of the allergy test, the severity of reactions when they outgrow it, aren't hard and fast, and you do get some children who have the milder form but will have severe reactions or large allergy tests or still not outgrow their allergy test till they're older, and likewise some of the children with a more severe form who react to milk or egg when it's baked still outgrow it relatively young or have milder reactions or small allergy tests. What this means in practice is that it's actually very difficult to differentiate between children who have the milder form of milk and egg allergy or the more severe form. Yet, as I've mentioned, it's really worthwhile finding out which type you've got because it allows you to introduce those foods into the diet and potentially speed up the development of outgrowing the allergy. The only way to be absolutely certain which type of allergy you've got is to try the food in the baked form and see what happens. Do you have a reaction or not? If you do have a reaction, then clearly you've got the more severe form and you have to avoid it completely, whereas if you don't react, then that means that there's an opportunity to introduce that into the diet regularly. Your doctor will advise you specifically for your individual case how to go about doing this. In some children that we think are very low risk, we might ask you to try doing this at home and we'll provide you with written information in the clinic of exactly how to do this. This will involve a recipe for a fairy cake that's got a measured amount of milk or egg in that's then baked for a specified length of time, and you try it with your child on a day that they're well at home to see how they get on with it. In children where we think this may be more of a risk of having a significant reaction, we'll do this in a hospital setting and we'll bring you into our clinic and give you that same fairy cake under supervision to see exactly what happens, and if there's any sign of reaction, we can then quickly treat it. Once you know which type of milk or egg allergy you've got, then it means we can make decisions about how to manage things going forward. Going forward. Going forward. Going forward. Going forward. Going forward. Going forward.